Hello, everyone. Greetings and happy 40th anniversary. 40 years is a really long time when you think about it. Many initiatives seem to fizzle over time, but I'm very proud to report that our shareholder work grows stronger each year. We have many bright new minds who are totally dedicated to making our world a better place to live. Thanks to you all for the opportunity to reflect on the history of health issues over the arc of these 40 years. Access to affordable and quality healthcare is essential to the health of communities and essential to our economic well-being. We believe that access to health is a very basic human right. Our goal is and always has been to assure that affordable access to appropriate products and services are available to everyone, but especially we focus on the chronically underserved communities around the world. Of course, over the last 2 years, COVID has consumed us, causing millions of deaths around the world. We have spent lots of public money developing new vaccines and new treatments. Over 70% of people in high-income countries are vaccinated today. However, less than 8% of those living in low-income countries even have access to vaccines. This exposes all of us to risks. So the fight with COVID goes on, and I'm sure you'd like to hear about that someday. But the 2 or 3 year pandemic is just a big blip in our 40-year history. If you close your eyes, maybe you can remember a time before masks. Let's try to go back to the 1990s, when there were millions of people around the globe living with HIV/AIDS. For many years, shareholders focused on obtaining affordable medicines to treat AIDS, as well as focusing on the concurring diseases like tuberculosis, like hepatitis C, even malaria and other neglected diseases that are frequently seen in low-income countries. We were successful with getting companies to develop more patient-friendly formulations, and successful to some degree at getting them to lower drug prices. Eventually, though, we convinced them to join the medicines patent pool, which assures that there are generic versions available of these drugs, and they're available worldwide. Today, these diseases, unfortunately, have not disappeared, but the treatments for them have greatly expanded, and we'd like to take some credit for that work. Over time, the diseases change, but the underlying issues of access and affordability remain the same. The first resolutions addressing drug pricing actually were filed way back in the 1970s, and the most recent were filed this year in the year 2022. This means that this type of resolution addressing access and pricing covers the entire 40-year arc of SRIC history. There has been continuous advocacy to press for access and affordability of medicines for all our brothers, all of our sisters. Most efforts with pharmaceutical companies are to increase access in low and middle income countries. But we do not forget that 1 in 4 adults in the US today either does not fill a prescription, breaks tablets in half, or skips doses altogether because they cannot afford their prescription. Today, even insulin, which was isolated over 100 years ago, is often not affordable to families in the US without adequate health insurance coverage. And while significant and continuous energy has been focused on increasing access, we would be totally remiss not to mention the very important work we've done in limiting access to unhealthy and harmful products. What actually coalesced health as an issue group in the late 1970s was the widespread promotion of infant formula. Manufacturers were making lots of money by promoting the formulas as the in thing. No longer was there any need for new moms to be stuck at home breastfeeding. Unfortunately, there were so many countries that lack clean water and refrigeration. Plus, formulas simply do not offer the protective antibodies that mother's milk offers. So infant mortality rates skyrocketed during that period. Today, most countries, I'm pleased to say, have guidelines that heavily favor breastfeeding with specific infant formulas reserved for specific medical conditions. The 1980s also saw another nutrition-related campaign against companies like Nabisco, Kellogg's, General Mills, all those common names, which were all promoting processed foods that were heavily, had lots of sugar, lots of excess sugar, and promoting them both to low-income populations as well as to low-income countries. Again, the companies profited and consumers suffered. Witness the worldwide obesity and diabetes epidemics that are evidence of this continuing challenge today. In the late 20th century, the health group began focusing on tobacco and the fact that tobacco and smoking was the largest cause of preventable death in the United States. Shareholders pioneered resolutions asking for smoke-free environments in restaurants, followed by many proposals asking drugstores and other health retailers to discontinue selling tobacco products. You'll note that today, most US restaurants do not allow indoor smoking and most drugstores do not sell cigarettes. By the early 21st century, the opioid epidemic was ravaging this country as a major public health crisis. In fact, in 2017, there were over 130 deaths each day from opioids. It's another example of selling too much. Companies were profiting by advertising prescription opioids as completely safe. Shareholders won many majority votes asking for oversight of opioid sales and also asking that executives not profit from the sale of opioids that were pushed to doctors and the public. So I hope you all will have a chance to take at least a quick look at the health timeline that they've attached for a bit more detail of our 40 years of. We were instructed to make a prediction for the future of our work. And I must admit that I would not try to predict what the next pestilence might be that strikes us. But I would predict that these viruses are very smart and very wily, and that we have not seen the end of them. We may be tired of viruses, but they are not tired of attacking us. But I can explain how the healthcare group decides which work they focus on. Each year, health sector leaders gather together to assess the major issues impacting the global communities as well as the US. And then they assess whether they can make a difference in these areas and how they might make a difference using their shareholder portfolio. So yes, we are still searching for the promised land. I love that slogan for this meeting. SRIC shareholders have been courageous movers on healthcare issues, but the work really must continue. I want to thank all of you for devoting your time and resources to this issue. Your stewardship makes a positive difference in this world. Have a great evening.